Good morning, everyone. This is Dr. Van Merkel at Take Two Healthcare. It's great to be with you this beautiful, sunshiny day. Wow, this is awesome. It's a little cool out there, but it is very nice, and I encourage you all to go out and enjoy it. We're going to talk about the benefits, the direct benefits of being in the sunshine regarding COVID-D. We got a lot of great information we're going to go over today. We're going to talk about masks, the good and bad. Oh yeah, there's bad about wearing a mask, which you need to know about. Talk about nursing homes, what's happening in Florida, risk factors, which we all know about, and some things that you can directly do to improve your health to reduce your risk of COVID. And if you haven't heard me before, these are gonna. If you have, you need to be reminded of them and the significance of these things, not only now but for going forward in the future. I'm Dr. Van Merkel. I'm a doctor of chiropractic. I'm board certified in clinical nutrition. I've been here in the Miami Valley going on, oh my gosh, let's say 35 years, right here behind this marvelous microphone of WHIO for over 25 years. And it is an honor, it's a blessing to be with you. And it is great that we have so many people out there, so many patients that we have taken care of over the years. It's really an honor. And we are humbled by so many people who come and ask for our help. And we've had some absolutely wonderful patients over the years. And I could just talk so many. I saw a lady this morning who we've helped from some severe problems that she had. And here she is 10, 15 years later doing absolutely marvelous. And Amy, if you're listening, hello, Amy. And you know what we're talking about. And it is just so encouraging to see how well she's doing. And there are so many others I could talk about. And we have great doctors here that can help you with your problem. And we have Dr. Andrew Dyer. He's board certified in clinical nutrition as well as being board certified in acupuncture. Dr. Marchek, board certified in acupuncture and board certified in clinical nutrition. And Dr. Yaley is certified in thermography and in reading thermography. So we have quite a group here. We're all chiropractors. We can help you with so many things. And the first thing I want to talk about today is get healthy, stay healthy. The strength of your immune system is the most significant determinant of whether or not you get sick from COVID-19 or any other cold or flu virus. We know that those with poor health are experiencing the worst outcomes. But a few simple vitamins to boost your immune system might just help you weather this crisis. The healthier you are, the better outcomes you will have. So clean up your diet. And at Take Two Healthcare, we have a simple protocol to optimize your health and boost your immune system, which we're going to talk about here in just a few minutes. I also want to share with you something else that the doctors have agreed to do and our clinic is going to do to help you out there in the community. I know that everyone has been affected by the COVID virus. Everybody, some more than others. And in our efforts to support our community now through June 30th, we're offering a 50% discount off our services to help you reach your optimal health status. These include nutritional consults, chiropractic care, acupuncture, therapy. Listen close, lab testing and nutrients are excluded, as well as thermography. But all our other services will be reduced by 50%. Again, that's now through June 30th. We're offering a 50% discount. Our office has been and will continue to practice safety measures to ensure a clean environment for your experience. We also offer consultations with our doctors over the phone, so you have to step into an office and you get tested at safe draw centers. So we are working to help you people out there. Everybody's been affected for it, but I know you might have nutritional health concerns. You might be struggling with symptoms of the COVID virus, and we can actually help you without you ever stepping in the office. With our online consultations, lab testing, we can send you to get safe draw centers. The labs are reported back to us. Our doctors will write your report, and then the vitamins or nutrients can be drop shipped right to your door. Pretty amazing with technology, what we can do. But call our office or our website is take2healthcare.com, take2healthcare.com. But let's just go over briefly. I know we've been pounded over the head with this, but who is at greatest risk? If you're overweight, you're at greater risk. If you're overweight, you have natural inflammation in your body, and that is a risk factor. If you got high blood pressure, diabetes, heart disease, asthma, lung disease, if you smoke, you're at increased risk. If you're doing vaping, you're at increased risk. If you're doing marijuana, you're at increased risk because all that stuff Anything you're doing like that, smoking increases lung inflammation, which is bad for you. Bad for you. And so whenever I see, on the TV, we're all, and rightly so, we're all, sad when somebody dies, and even somebody young that dies. But I have yet to see anybody die on TV that was not in one of these categories: obese, smoke. And if you're obese, you're probably diabetic or borderline diabetic. You probably got high blood pressure. And so I know they talk about, if you're obese and all this stuff, but look what happens in our country. If you're obese, you're probably on blood pressure drugs. If you're obese, you're on cholesterol drugs. Well, guess what? I believe it's those drugs that make you more susceptible to COVID than the actual condition itself, than actually being obese. Because we know that the cholesterol drugs actually suppress your immune system by affecting your liver function. Blood pressure drugs, every drug you take reduces your immune system. And a reduced immune system is what opens a door for COVID. So what we've got to do is get healthy, get off those medications. So there's also something else that is very critical here that we want to talk about. With COVID-19, and that would be what else is contributing toward us being sick? What else truly may be a risk factor in us being sick? Let's see, I'm having just a little technical difficulty here. And I want to make sure, I don't know if you guys can hear me okay. That's my concern. And I think my mic is turned up, but let's see if that helps a little bit there. Okay. There's one other thing that may directly contribute toward our problems that we've got, and that is the flu shot. And I know it's going to cause a lot of a lot of concern with some of you. But there's an article. It was published again online in October 10th, 2019. It was at the Armed Forces Health Surveillance Branch of the Air Force, and it was done right here at Wright Pat Air Force Base. Now, the purpose of this study was to determine if the flu shot increased the risk of other respiratory viruses, including COVID, including the coronavirus. The study right here at Air Force Base, does our people in the military, our military men and women, does it increase the risk of getting other things if you get a flu shot? Well, here's what it came down to. Those who received a seasonal flu shot were 36% more likely to contract coronavirus. 36% more likely to contract coronavirus, and 51% more likely to contract a pneumonia virus. So the flu shot increases the risk of you getting coronavirus. Now let's just look at things here. Where are most people dying to get this corona? People who are in where? Yeah, who are in nursing homes. And do you think that probably everybody who's in a nursing home has had a flu shot? And everybody who's in a nursing home is on blood pressure meds, cholesterol meds, and et cetera, et cetera, et cetera? Yeah, they're the sickest people. Now, I heard an interesting story on TV the other day, maybe yesterday, the day before, where they were saying that the governor in Florida, when this first started happening, he locked down the nursing homes. Now, Florida has one of the highest rates of old people per population of anywhere else in the country, and yet they have one of the lowest death rates. And the governor says it's because they locked down the nursing homes, which means if you're a nursing home, you're not getting any visitors. You're not getting family and friends coming in to see you, because that can be a problem. So he locked everything down. What a marvelous idea. Now let's put this to the bigger picture. Is it a good idea to lock down the whole country? Is it a good idea to lock down the whole country to try to preserve or delay dying those people who are in a nursing home or are at high risk because of self-induced problems? If you're at high risk, if you're obese, if you're on blood pressure drugs and cholesterol, you need to self-isolate. And if you're in a large home, if you got other people in home, you need to stay in your bedroom like you're in a nursing home. And then they bring things to you like you're, in a isolation jail. They set it down, let it sit there for a few minutes, and then you come and pick it up. Is it worth wrecking our entire economy, our country, ruining your children, your grandchildren's lives to try to preserve and delay the dying of some people? Would you agree that people in a nursing home have some very serious health problems? Yes, but even isolating them helps to slow their death rate down. And if you're at high risk, why don't you just self-isolate yourself instead of everybody else being affected? Now, I was in Florida this last weekend, and they're opening up the beaches. It's a wonderful thing. It's a wonderful thing. They're opening up, and we need to start opening up our country too. And if you are at risk, you do things. Don't make the rest of us suffer because of your poor choices. If you're overweight, you're diabetic, you got all these things. I'm not talking about type 1 diabetes. That's a different story. But if you're type 2 diabetic, that's all self-inflicted. If you're type 2 diabetic, those are choices you've made to be type 2 diabetic. If you got high cholesterol, if you're overweight, those are all choices you've made. Oh, is that mean? Well, it's a fact. It is a fact. And so what we need to do as a country, as a people, as a community, is take responsibility for ourselves. Okay, you're diabetic. You want everybody else to be you're obese. You got high blood pressure on all these drugs. So you want everybody to be afflicted because of your inability to stay healthy. We've all got to suffer. Well, that's not a good thing to do. Let me ask you this. If you had a family friend, neighbor, spouse, mother, father that was terminally sick, would you pay out of your pocket, let's say, $30,000 every month? And as long as you paid that $30,000 every month, they would live, but they're going to die in 6 months anyway. Would you pay 6 months $180,000, $200,000 to keep your mother, father alive a few more months, knowing it's going to be terminal? Would you pay that? Really, honestly, would you pay it? And yet that's kind of what we're doing here. We are paying to keep people alive who maybe have made bad choices in life. And I like what the governor did in Florida. He put all of his nursing home people locked down. Nobody's coming in. And if you are at risk, you need to lock yourself down. The rest of us, we need to get back to life, go back to living. Now, when we come back, we're going to talk about some more risk factors and the benefit of being out in the sun. But you're listening to Dr. Merkel at Take Two Healthcare. We'll be right back after these messages.
Ask the Expert Weekend. News and talk.
And we are back. I'm Dr. Van Merkel, Doctor of Chiropractic, board certified in clinical nutrition. Our office is in Royal Swiss Village. That's just north of Whip Road, about a quarter mile, like I said, in Royal Swiss Village. And it is great to be with you. And we'd be honored to help you with your health problems. And now, don't get me wrong. We do not have a treatment or cure for COVID-19, coronavirus. In fact, we don't have a cure for cancer or MS or lupus. We do help people with those conditions. In fact, here's what I've said for years. I know it's absolutely true. If you get healthy enough, does it really matter the name of the disease? If you get healthy enough, does it really matter the name of the disease? Not everybody's getting COVID. In fact, and I went over these stats last week. Only about 8 people out of 1 million in Ohio are dying from the virus. 8 million. 8 out of 1 million are dying from the virus in Ohio. And the majority of those, vast majority, are in nursing homes. And the others are people who are already sick and are on drugs. But now the flu shot, as I talked about before, and I know that everybody's all at Twitter about getting a COVID virus vaccine. COVID vaccine. I would avoid that like the plague. For one thing, it's not going to be tested very well. It's not going to be studied very long. We're not going to be long-term. We know that the regular flu shot we get works, and this is on the med page. online med page that medical doctors said only 1 out of 100 people benefit from the flu shot. 1 out of 100. Plus, we also know that if you get the flu shot, now that it makes you more susceptible to coronavirus, to getting. So if you take the COVID virus, is it going to make you more susceptible to everything else and even worse stuff? And if you take the COVID and the flu shot, we got the Wild West. We have no idea what's going to happen now. You're setting yourself for all kinds of problems, because when you take a flu shot, you're dedicating a large percentage of your immune system to only seeing that flu, which is why it only helps. Which is why when you take a flu shot, it makes you more susceptible to coronavirus, because your own body's natural systems are now dedicated. So that doesn't help. So I wouldn't do the flu shot. I don't do the flu shot. My mother, 88, has never taken the flu shot, doesn't get sick, and she would not get it. But, okay, here's the thing. Remember I talked about the factors, obesity, drugs, and that kind of thing? My mom, okay, she's a sweet little grandmother, but she's a fat little, sweet little grandmother. She weighs about 5 foot nothing. Excuse me. She's 5 foot nothing, weighs about 200 pounds. She is obese, but she's not taking any drugs. The only drug she takes is one little low dose blood pressure drug once a day. That's it. Now, how many people who are 88 years of age are on only one little drug? Most of them are probably on 5, 6, even 8 or 10 drugs. So the fact that she's on no drugs, I think, is the major factor for her. Not the fact that she's overweight, but the fact that she's on no drugs except that one. Doesn't take any over-the-counter, doesn't take Tylenol, doesn't take aspirin, doesn't take Advil, doesn't take any other drugs. Just one little pill a day for blood pressure. And so I think that's the main thing. I would really like to see the studies on these people who are dying. How many drugs are they on? I see doctors on TV. They're worried about getting sick, or the doctors are dying. But what are they doing? Are they smoking? Are they doing marijuana? Are they vaping? Are they on blood pressure drugs and cholesterol drugs? It reminds me, a couple years ago, the president of the American Heart Association, a 50-year-old guy, had a heart attack at the American Cardiology Convention. A 50-year-old medical doctor had a heart attack. And you can bet he was probably on cholesterol meds and all these other things. So I think if you're thinking the COVID shot is going to come and save the day, you better be thinking again, because it hasn't in the past. Read about the swine flu. In fact, the swine flu, one of the TV shows did 60 Minutes said the CDC flat out lied about the swine flu, about the effectiveness of the swine flu. So you can't even believe the CDC about things. So what you need to do is what I'm telling you. We're going to give you a protocol to follow after the break on things that you need to do. Now, one of the things is sunshine. Now, don't take a walk yet, because we still got some great things to cover here. I know it's time for a break, but we're gonna cover all these things that you need to do today and in the future to keep your body healthy, to get healthy, to avoid serious problems in the future. I'm Dr. Merkel with Take Two Healthcare. We'll be right back after this.
It's our Ask the Expert.
And we are back. This is Dr. Van Merkel with Take Two Healthcare. Great to be with you this beautiful sunshiny day. Okay, it's a little brisk, but it's still beautiful and sunshiny out there. So hopefully you'll get out and enjoy it today. Now, just wait till after the show's over, because we got some very good information we got to share with you. We're going to be talking about a protocol you need to follow, vitamins to get your body healthier if you have any symptoms at all. And remember this, sometimes the best things in life are free. And we're going to talk about that in a minute. But first, I want to talk about first of all, I want to remind everybody that to help everybody out right now, we're having a 50% discount at our clinic. I know the COVID has affected everybody financially, and even our clinic, but we're still going to try and do what we can to reach out and help people who have health problems. So we're reducing our fees for our consults, our chiropractic adjustments, acupuncture, things like that. We can't reduce our lab fees and our vitamin fees. Those are already greatly discounted, and we can't, and there's no discount on thermography. But we're offering it's not going to be a discount. It is a 50% reduction in fees until June 30th. So if you want some help, you need some help, we're trying to help as much as we can. And the 50% discount is until June 30th. So call our office at 433-3241 or go to our website for more specific details. Go to our website at take2healthcare.com. All right, the mask. People are wearing them, and they are good. The idea of a mask is I wear a mask so that my germs, my stuff I'm breathing out doesn't go to you. So I wear a mask to protect you. You wear a mask to protect me. However, if there's nobody around, don't wear a mask. Don't wear a mask when you're out walking. If there's nobody around you or you're walking with a friend that you've been with for a long time, I see people out walking all by themselves with nobody around and they got a mask on. Here's why you don't want to wear a mask. Your body has several ways to eliminate bad stuff. Toxins, metabolic processes, toxic chemicals, bacteria, viruses, that kind of thing. And the most common ways we know of are urine, having a bowel movement, stool, is two of the primary ways, but also sweat. Yes, when we sweat, that's why sweating is good. It helps to get toxins out of our body. But one of the other ways that is very, very important is breathing. When we exhale, we are naturally breathing out carbon dioxide and bacteria and viruses and all this other stuff that is accumulating in our lungs. So we naturally breathe those out. We're expelling those and reducing the load of those bacteria and other bad things in our body by breathing out, by breathing deeply. We clear out, I'm breathing deeply now. We're breathing deeply and getting all of our lungs and all that bacteria and stuff to breathe out. Now that's why we're masks, so when we're around other people, that we're not breathing on them. We don't want to do that. But when you're out in public, when you're not in public around other people, you need to breathe freely and get that stuff out of you. Because when you got a mask on, you are rebreathing your own gunk. The own crap you got in your body, you are rebreathing it. Infecting yourself or multiplying the infection by not breathing out by not breathing out the air and not breathing in fresh air. So don't wear a mask. Now I've heard there are some people putting on masks on little infants. Don't do that. If they're at home, they're around people they know and things like that, do not put a mask, because you are reducing not only the breathing ability, but you're also, I believe, you're going to be increasing the carbon dioxide because you're not getting the good transfer of air. If you have that mask on, you're not getting the transfer of air that you would without the mask. You're not getting the full breath in and breath out of uncontaminated air. You're getting contaminated air, so don't use a mask. When I use a mask, I put on when I'm going into the store, and pretty much as soon as I'm out of the store, it's coming off. It's coming off. We don't need it. Especially today, we don't need it. Why? Why don't we need a mask today? Because we have sunshine. We have sunshine. And it says, oh my gosh, sunlight and humidity kills the coronavirus faster than virtually anything else. How about this? In a high humidity environment, which is we get as the weather gets warmer, the half-life of the coronavirus dropped to 6 hours. 18 hours on regular surfaces, 18 hours, down to 6 hours with just high humidity when the virus was exposed to high humidity and sunlight. The half-life dropped to 2 minutes. The half-life dropped to 2 minutes when you're out in the sun. And that is why you need to be out in the sun. You need to open the windows, get the air moving in and out, because the air moving in and out gets the air out into the sunlight. The sunlight kills the bacteria, the viruses, and that's a good thing. So when you go outside, don't wear a mask. Unless you're in some crowded environment, but probably not. When you're out in the park walking around and you're 6 feet from someone else, don't wear a mask. Because you're not going to be 6 feet that long. You might pass somebody. But once you're past them, you need that fresh air. You need to get the gunk out of your own body and let the UV light, the sunlight, kill what's coming out of your mouth, out of your body, and you breathe in fresh, clean air to help your body stay healthy. So how amazing is that? That sunlight that is free kills the coronavirus fastest And here it is. U.S. scientists say coronavirus dies the fastest when it's exposed to direct sunlight. So go out. Don't worry about a sunburn. Don't worry about skin cancer right now. In fact, I don't recommend you go out and get a tan, actually. A tan would be a good thing. Okay, it's going to be a little cold getting a tan today, but at least go out and get some fresh air. Because even if you're not getting a tan, what you're breathing out, what you're breathing in, has very, very low virus in it because of the sunshine. Also, what do you get in the sunshine? You get vitamin D. Oh, yes, vitamin D. And vitamin D, let's see. Oh, vitamin D associated with, lack of vitamin D associated with many lung disease, pneumonia. People who have respiratory illnesses, they all do better, have better outcomes when their vitamin D levels are optimized. And I mean, you need to be above 50. I'd like to see around 70 units. And we tested a fellow just the other day, a black fellow who was at 14, extremely low, extremely low. In fact, if you are dark skinned, you need more vitamin D and more sunlight than what I do. I'm a light skinned guy. And so if you're dark skinned and the darker the skin you are, the more sunshine you're going to need. In fact, I doubt you're going to get enough sunshine to raise your vitamin D up to sufficient levels. Now, I recommend virtually everybody during the winter take 5,000 international units of vitamin D. 5,000 international units of vitamin D. Now, for $40, about $40 to $50 a year, you can get 5,000 international units a day of vitamin D. And if you're very low like this fellow who is at 14, I'm recommending he take 10,000 a day for at least 2 weeks to get his reserves up. Instead of 5,000 until he gets tested again. But you have no idea where your vitamin D levels are unless you test. And that's what we do at our clinic at Take Two Healthcare. We test everybody. We want to know. We're not just going to throw vitamins at you. We want to test to make sure that what you're doing is the optimal and it's going to do the job. That's why we've helped people with MS, with lupus, with Crohn's, with ulcerative colitis, with cancers, with MS, with all these autoimmune disease, with various cancers. We've helped virtually everyone by helping them be healthier. We're not treating those conditions. We're not treating COVID or Corona. But I know that if you got a strong immune system, let me say it again, if you get healthy enough, does it really matter the name of the disease? Think, I know we're all worried about Corona, but the facts are only 8 out of 1 million people in Ohio are dying from Corona. What does that tell you? The 8 that died were in pretty bad shape, weren't they? The 8 that died were in very bad shape. So can you be better, healthier than 99.5% of the population? Or 99.9%? There's that little, what is 8 out of 1 million? I mean, that's way less than 1%. So can you be healthier than that? Okay, yes, you can. And we're going to give you some things to do. Take some vitamins. Now, one of the things I recommend, as I said, get tested. Because conditions in your immune system function, deficiencies and imbalances will show up in the blood long before you have symptoms. If you're waiting till you got coronavirus to get tested, well, why not get tested now? Because main diseases, conditions, imbalances, deficiencies, even your immune system, how healthy it is, will show up in the blood long before you get symptoms. I test myself twice a year. The healthy you are, the fewer disease you're going to get, and more than likely, the longer you're going to live. So there we go. Okay, vitamins. And again, we're getting a 50% discount. I talked about earlier. Go to our website for details. But what I recommend, vitamin D. Okay, yeah, vitamin D, of course, by getting outside, but also take vitamin D, especially now. You want to get through this corona, take vitamin D. Vitamin C lowers sepsis mortality. Vitamin C, very important, has helped many people. Now, we've got this protocol, and I'm showing it on on the webcam here. We're going to have a blog on that. It's going to show up. And I'm recommending a product called SBNCC. SBNCC, curcumin complex, what that means. Now, it's got a lot of nutrients you're going to need to help fight the coronavirus. Vitamin C, ascorbic acid. It's only got 100 milligrams. It's got turmeric, which is turmeric, bioflavonoids, ginger, and vitamin C are all antiviral. Now, this has got vitamin C in it, but if you got any symptoms, I'd recommend you take maybe an extra 2,000 or 3,000 milligrams a day, maybe more. If you got symptoms, crank it up to 7,000 or 8,000 milligrams a day. But I recommend you start off taking at least 6 a day of these during this period of time. And if you're showing any signs of symptoms, take 12 for maybe 2 weeks. So there's that. Then we've also got a product called lauricidin. Lauricidin is one of the strongest natural antiviral, antibacterial, and antifungal nutrients I've ever found. It's from the coconuts like mother's milk. It's amazing. And for loracidin, I recommend you take 2 scoops a day. I take 2 of these every day. In fact, I take about 6 of these every day too. So if you got any symptoms of cold or flu or corona or whatever, take 4. Vitamin D, where you talked about vitamin D, zinc. Now, zinc lozenges are hard to come by right now because everybody's buying them, because we all know that zinc is phenomenal for respiratory infections. It's been shown to reduce the cold and flu, the duration of cold and flu, by half over anything else. That's why you're seeing zinc in cough lozenges now, because it helps so much. So zinc. Now, how much do you take? I'd recommend you take at least 20 milligrams a day, maybe up to 40 or 50 milligrams a day. The zinc lozenges generally have about 15 milligrams. If you can't get zinc lozenges, get the zinc tablets. They may have 50 milligrams. So break it in 3 parts. And when you take it, the powder, put it under your tongue. For some reason, zinc works better if it's absorbed sublingually. So just hold under the tongue, let it be there, and it'll slowly dissipate out, and it'll take care of that. And so vitamin D. Now, I've talked about before, we have a product called Daily 8 that's a multiple vitamin. It's got vitamin D. It's got all these products except this curcumin, CC, and loracidin to help boost your immune system. This is what I recommend to help get you going now until you can get yourself tested. Right now would be a good time to get tested because your consults are going to be 50% off. So that is always a good thing. So just to review, things that you need to do right now: get out and exercise, do what you can, eat better. You got to cut out the crap. If you want your body's immune system to be working at optimum levels, you got to cut out the pop, the sugar, the pies, the cakes, the candy. Hate to tell you, but that coffee that you're drinking with all that chocolate in it and the sugar and all that stuff is not good for you. In fact, I don't think coffee is good for you either. But definitely anything where you're loading up with sugar, coffee is bad for you. If you smoke, if you vape, you need to stop that, and you need to start eating better. Cut out your fries, your French fries, your fried foods, your junk foods, your chips and things like that. Eat good quality food. Eat vegetables. Eat lots of salads. I'm eating lots of salads, which I do all the time. Lots of salads. And then I always put some extra things in it, seeds and nuts and things like that. Don't do your ranch dressing. Do your better vinaigrette dressings. Say, you hear that noise? It's time for me to take a break. You're listening to Dr. Merkel at Take 2 Healthcare. We'll be right back after these messages.
It's an Ask the Expert.
And I am Dr. Van Merkel, Doctor of Chiropractic, board certified in clinical nutrition. And I've been here right behind this microphone for over 25 years, right here in the Miami Valley for 35 years. You can contact our office, and we can help you with your health problems at 433-3241. That's 433-3241. You can also go to take2healthcare.com for great information on how you can be healthier. And we've talked about so many things today that you can do. And start doing these things now, because if you do these things, take your vitamin D, those kind of things, you're not going to need a flu shot. Their studies show that taking vitamin D is better than a flu shot. It's cheap, it's safe, and it's effective. We'd do far better if we'd have people taking vitamin D than if they were getting flu shots. And now we know that flu shots increase risk of getting the coronavirus. Wow. There's going to be side effects. There's going to be bad stuff happen with the COVID vaccine too. So don't do that. But I want to talk about what's the most important thing you can do for your mother. It's Mother's Day tomorrow. And what's the most important thing you do for your mother? And for you mothers out there, what's the most important thing you can do for your kids? What's the most important thing you can do? The most important thing that you can do for your spouse, your kids, your grandparents is not to be dependent on them. The best thing you do for your spouse, your kids, and your family is not to be dependent on them. Not to be physically dependent, which means you need to take better care of your health. I know your wife or your spouse will probably take care of you if you get sick, but I think they'd rather prefer that you not be sick. I think they'd rather prefer that you stay healthy, you get healthy, you lose weight, you get off your diabetic medication, you get healthy so you don't need your medication. You know, my job is not to get you off your drugs. My job is to get you healthy so you no longer need them. And if you no longer need them, don't you think that's a good thing? If you don't need that blood pressure drug, if you don't need that diabetic, your glucophage, if you don't need that cholesterol med, would that be good? Absolutely it'd be good. So why don't you do something for your family? I know you've been given a free ride, that you want to do whatever you want to do, and the insurance is going to pay for the health problems. Well, now we got a day of reckoning, that when you do what you want, this virus could kill you. That's what's coming down to. You do what you want, Eat what you want, smoke what you want, do whatever you want, get grossly obese, take lots of drugs, yeah, now you're at greater risk of dying. And now because of that, we have wrecked our economy and even the future of your children and your grandchildren. So, you willing to start getting healthy and take care of yourself, being responsible? We're here to help you at Take Two Healthcare. We've had people who are on tons of drugs, absolutely tons of drugs, that over a few weeks, sometimes months, it's amazing how many they got off of. In fact, sometimes they get off all their drugs. Yeah, yeah. But your medical doctor, what did he do? He treats symptoms. You got high cholesterol, take a cholesterol drug. You got blood, take a blood pressure drug. You got headaches, take a pill for headaches. We get to the heart of the problem. We get to the base, the bottom of the problem. So our goal is not to get you off the drugs, get you healthy so you no longer need them. And don't you think you're healthy if you don't need the drugs? That's what we're talking about. So the most important thing you do for your family, friends, your spouse, your children is not to be dependent on them. It is up to you to make the choices so you get healthier. And I've talked about some today. Let me just review them again. Let me review them. Take your vitamins. Don't get a flu shot. Take vitamin D. Wear a mask when you're where you should. Wear a mask when necessary, but only wear a mask when it's necessary. Get out and walk. Get fresh air. Get sunshine. The more you walk, the more you breathe. Breathe deeply. Get that air, oxygen in and out. Don't let that bad crap stay in your lungs. Get it out. And don't breathe into a mask that you're just going to rebreathe that crap right back in. Breathe deep, take nice walks. We got some beautiful parks. And by the way, any officials out there, we're not stupid. There are a lot of businesses like mine who are responsible. Long before that stuff came in, my staff got busy and they all got masks. They started cleaning properly. And people are smart. There are businesses open now that aren't supposed to be open. But look, the owners of these businesses are smart. They don't want their people to get sick. And so they are cleaning probably more thoroughly than is even required or necessary. So don't treat us like we're idiots out there. We don't want our people we work with to be sick. That's why we wear masks. We clean everything. Everything is properly cleaned. If somebody gets adjusted, the table's completely clean before the next person gets on. And so stop treating business owners like we're stupid. We want to do things right. We want our people to be healthy. Let us have that opportunity to do those things for our clients. But let us get back to work. Now, I know our clinic has not been shut down, but I know a lot of other friends whose businesses have been shut down. They're smart people. They want to help. They want to be of service, but we got to stop treating them like they're stupid. Let them take responsibility. They know how to take responsibility. They didn't get to be successful in business by being stupid. So let them do the right thing and let them open up their clinic or whatever business they have and open it properly. Okay, I'm a little bit, sensitive with that because I'm a small business owner and I know a lot of small businesses are hurting right now, but don't treat them like they're stupid. Let them take responsibility. They will do the right thing. And the people that they're dealing with probably aren't at great risk anyway. It's the people who are in nursing homes and people who haven't taken care of themselves. We're looking to help people take better care of themselves. So I know it's about time for me to go. I'm Dr. Merkel. If you'd like our help, and we'd be honored to help you, even this time, we can do it over the phone, long distance. We can ship things to you if needed. Your rec forms, your whatever, we can ship them to you. And you can get safe lab testing done. So don't let that be a hindrance. And right now, till June 30th, we have 50% off a lot of our services. Look at our website to see exactly what that is, but we're being affected too, but we're willing to help out as we can. So do something today to be healthier than you were yesterday. Take a walk, get some sunshine, take vitamin D, C, zinc, turmeric, and lorcidin. Call your family and friends. And by the way, take better care of yourself. I'm Dr. Merkel. Have a great day.